Hello, everyone. Welcome to Lump Auricular Medicine course, day 2. Today, we take up the 10 points of the triangular fossa and 10 points of the lobe. We shall master the 100 common points of the ear by organizing the points within each anatomical zone in relation to each other. So this is the ear map in Chinese auricular acupuncture. And these are the ear points of the right ear. 10 points of the triangular fossa. These are points that relate to nervous and hormonal regulation and pelvic organs. And these are, number 1 is Shenmen. Number 2 is stop wheezing. 3 is hypertension. 4 is sympathetic 1. 5 is sympathetic 2. On the underside, number 6 is sympathetic 3. 7 is uterus or prostate. 8 is constipation area. 9 is hepatitis. Number 10 is hip joint. Remember, the triangular fossa is a depression, slightly darker hue than tissue of superior and inferior antihelix cruras. During pregnancy and menstruation, you will note that the triangular fossa is oftentimes bright red. If the patient has painful periods, it tends to be on the dark side. The darker the person's skin, the more difficult it may be to see any pathology, so look closely and practice observation. A simple tip that can help with demarcating triangular fossa's upper border is to gently press the helix of the ear inward in a medial direction. When you do this, the superior antihelix crus becomes more visible and elevated, thus making the triangular fossa's upper border clearly demarcated. Number 1 is Shenmen. This is located in the triangular fossa along the lateral border, superior to junction of its inferior and superior borders. Place the ear probe in this juncture and then slide superiorly to intersection. The probe will fall into a small depression, and that is the point. Number 2 is stop wheezing point, located in the deepest point in the center of the triangular fossa. Place the probe roughly in this vicinity and search by feel with the probe for the depression, which is where the point is located. 3 is hypertension point, located in the lateral superior corner of the triangular fossa. Next, we have the 3 sympathetics, sympathetic 1, 2, and 3. There are 3 standard locations of the sympathetic point. One is in the triangular fossa, that's number 4. Another is on the posterior border of the helix, and the third is below the triangular fossa. Sympathetic 1 is located in the medial-inferior corner of the triangular fossa. Sympathetic 2, which is number 5, is located on the posterior border of the helix, midway between level of sympathetic 1, which is number 4, and sympathetic 3, which is number 6. This is the first of 3 points located on the posterior border of the ear structure. Sympathetic 3, this is number 6, located on the inferior antihelix crus below sympathetic 1. Number 7, the uterus or prostate or the seminal vesicle, located midway between sympathetic 1, which is number 4, and the hypertension point, which is number 3. Number 8 is the constipation area, located on the inferior border of the triangular fossa. The area is equivalent to a rectangular shape. Part of it is along the inferior border of the triangular fossa, and part is along the upper portion of the inferior antihelix crus. Number 9 is hepatitis point, located at the junction of inferior and superior borders of triangular fossa. Number 10 is hip joint, located medial to hepatitis point on the lower border of the triangular fossa. So let us review the points. Number 1 is Shenmen. Number 2 is stop wheezing point. Number 3 is hypertension. Number 4 is sympathetic 1. 5 is sympathetic 2. 6 is sympathetic 3. 7 is uterus or prostate. 8 is constipation. 9 is hepatitis. And number 10 is hip joint. Now let's go to the 10 points of the lobe. These are actually the points of the head and face. Okay, and actually some of the points here can be used to lift the face. So that's something to look forward to. Now, dividing the lobe into sectors. To find the points located on the lobe, the upper border of the lobe must be established mentally or using the ear probe as a straight edge. Draw a horizontal line across the lobe at the level of the lower border of the intertragic notch that has slip-like cartilaginous shape to it. It is from there that horizontal line is drawn and upper border of the lobe is created. So again, to find the points on the lobe, we must establish the upper border of the lobe. So it is wise to use an ear probe, use it as a straight edge. You draw a horizontal line across the lobe at the level of the lower border of the intertragic notch. This is the intertragic notch that has lip-like cartilaginous shape to it. It is from there that the horizontal line is drawn and the upper border of the lobe is created. After locating the upper border of the lobe, we divide the lobe into equal thirds vertically and then equal thirds horizontally. This division can be done visually or using ear probe as a straight edge. 9 sectors are then formed on the lobe. These sectors are universally assigned numbers 1 through 9 as you read from left to right and top to bottom. Points are located in relation to these sectors. Most of these points are defined as in the center of the nth sector. For example, the eye point is located in the center of the 5th sector. So again, after you locate the upper lobe, we divide the lobe into equal thirds, vertically and then equal thirds horizontally. This division can be done if you use the ear probe as a straight edge. So as you can see, we have 9 sectors. And these sectors are universally assigned numbers 1 through 9. So 11 is 1. And okay, so 19. Okay, so we have 9. And we had to insert number 20, which is the insomnia point. So points are located in relation to these sectors. Most of these points, like for example, the eye point is located in the center of sector 5. So the upper teeth slightly below the center of sector 1. Tongue is at the center of sector 2. Jaw is the center of sector 3. The lower teeth center of sector 4. The eye center of sector 5. The inner ear center of sector 6. Helix 5, lateral border of sector 6. Tonsil center of sector 8. Helix 6, lower margin of sector 8. The insomnia, slightly medial to teeth points, numbers 11 and 14 on the horizontal line dividing the upper teeth, which is number 11, and the lower teeth points, number 14. So again, number 11 is actually the upper teeth. It is slightly below the center of sector 1, so it must be here. Number 12 is the tongue point. It is located at the center of sector 2. Then this is the jaw point at the center of sector 3. Lower teeth, center of sector 4, number 14. Number 15, the eye point is the center of sector 5. 16 is the inner ear point, center of sector 6. Number 17 is helix 5, lateral border of sector 6. Number 18 is the tonsil point at the center of sector 8. Number 19 is at sector 8, lower margin of sector 8. This is helix 6. And number 20 is the insomnia point, slightly medial to the teeth points 11 and 14 on the horizontal line dividing the upper teeth, number 11, and lower teeth points. This is number 14. Thank you for your attention, and we hope to see you on our next video.